On to Mayor Larson, who's speaking.
A few items, and we are in this room really specifically because we are working hard to contain COVID-19 as much as every other organization. So many of you know that we have closed public facilities, so we are just in the rotunda for this very short period of time so that we can relay information to all of you. And we have asked our speakers, we're kind of scattered around this room here, at the appropriate social distance so that we can practice containment strategies and model that for ourselves and others. Yesterday, well, I guess it's only Thursday, isn't it? So Tuesday, I signed an emergency declaration for the City of Duluth that will go before City Council at today's meeting. There is a resolution that will go forward. The intent of that is to build upon the emergency declarations that had been signed and passed by Governor Tim Walz and by President Trump. Our emergency declaration, we feel, gives us the ability to continue to be flexible but very focused on how we can be nimble at this time. For instance, it will allow our City Council to continue to meet today while the building is closed to the public. They will meet. A few of the members will be phoning in to just allow for containment purposes, and we will be practicing social distancing there as well. So it allows us to do that, to continue to function, and if you go in and look at the council agenda, there is a ton of regular business happening that we need to continue to be very, very focused on. So while many of us are experiencing this pandemic and working through the details of that, we also have hundreds of people here in the city of Duluth who are working on their everyday operations of the city. So CAO Shuckman will represent the administration at the City Council meeting. I will not be there tonight. He and Attorney Hankey are certainly well enough versed to work our team through that. I have a couple of announcements I want to make to all of you. First of all, we have added a COVID-19 page to our city website. If you go to duluthmn.gov, you can click on the red banner and that will take you to a page that has local resources and information on it. We are collecting a lot of resource information, as I know all of you are. We are trying to make it as easy as possible for our residents to get the information that they need. You can find a lot of information there. We are updating it daily with frequently asked questions, both local and state resources as they are created. So please check on that page often. I have an announcement as it relates to sales taxes and taxes that are due to be remitted tomorrow for February sales, hotel, motel, tourism tax, and other tax collections owed to the City of Duluth. We are extending the date by which those can be paid. They are due tomorrow for February. However, we have chosen to give a little grace time during this period of intense stress for our businesses. I need to assure you that we are not erasing those payments. Those are the payments that we will need to continue to provide the services that you need now, and all of the many services that will continue us into the future, not just through this pandemic, but through the long haul of all of the projects we have going on. So we will put out a press release shortly about that. We will update our website. Anyone who has questions, please feel free to call. We are receiving tax payments very regularly. Many people have already paid those. Thank you for that. Again, they will be due on April 20th, but we do want to recognize and give you some flexibility to be able to do that in a different way or provide a little more time for you to do that. Secondly, or maybe third or fourth, I don't know, kind of losing count, but our librarians are hard at work, working and planning for the next few weeks. Our buildings are closed right now, but I'm really excited to announce that next week the City of Duluth will be hosting story times. And we're going to have different people reading books. I will be reading a book, fire chief, police chief, and a few other special guests. So we are in the process of selecting books to read. We are creating a schedule. We are working with publishers to have permission to read those books and share those with kids. So again, connecting with you is really important, and we know these resources make a difference in your family life and in your home life. So stay tuned for that. We will press out information. You will find Storytime live on the library's Facebook page, so families can watch together. And because it's a public page, you don't need to have access to Facebook. You don't need to have an account to do that. And then lastly, before we move on, again, there's a series of speakers here. Thank you to the community leaders who are working so hard in support of this community. We are asking all of our speakers to be as brief as possible, and yet it's so important that you get all the information you need in ways that are accessible for you. But we are on day 3, the city of Duluth, of being home, of having workers be home and buildings closed. And with that said, I just want to say it has been amazing and incredible to see the outpouring of love and support in this community and what we are showing one another. From businesses giving away free hand sanitizer, to neighbors delivering eggs or fresh bread to one another, people calling to connect, people buying gift cards from local businesses that really need us to show up for them right now, and then sharing those gift cards with essential workers, sending letters to homebound seniors or senior citizen buildings that are closed so that we can stay connected to each other. This is the Duluth that we know. This is the Duluth that we love. We need to keep it going. There is joy in every single day. Sometimes we need to find it, sometimes we need to create it, but every day we get to be that joy for somebody else. So with that, we're going to go through our list of speakers, and we will start with Congressman Pete Stauber. Speakers, just come up when the person before you is done. Just come on up and introduce yourself. Thank you. Congressman?
Thank you, Mayor. Just a first quick briefing. Last night, the President signed the second COVID-19 relief bill. This was the family's first Coronavirus Response Act. And what it did, it provides the free testing to Americans, provides paid sick leave, and it protects seniors with severe medical conditions. And it expands telehealth services where Medicare will pay for that telehealth services. There are ongoing discussions about a third COVID-19 relief bill and what it may include. And my office is working hard. The third round is going to look more closely at our small businesses and how we can help them, how we can allow them immediate access to capital so they can meet their current obligations. And we're in that in those negotiations and talks right now. As you all know, the President invoked the Defense Production Act. This allows private companies to work on certain things needed for our communities, like personal protective equipment, ventilators, etc. And so I think that, as I've stated before, the full force of the federal government is is in force, working to protect American people, to make sure that we are all safe and healthy, in particular our vulnerable seniors. Small businesses are the backbone of this economy, and as a member of the Small Business Committee, I remain focused on identifying ways in which we can assist them. And we all have the opportunity to do that, from the federal government, from the state government, from our local government, including our cities and counties. And I want to encourage everybody, as the mayor just said, let's try and make sure that we take care of our small businessmen and women by ordering food if they have takeout, buying gift cards if they offer them, and also to have the ability to order online locally if they have that in place. It's incredibly important that we all take our part in social distancing. That's one of the biggest ways we can flatten that curve, because we do not, as stated earlier, we do not want to inundate our medical facilities or our medical personnel, and that responsibility is incumbent upon each and every one of us. No one is the exception. Let's all follow those recommendations from the CDC and other medical professions. Good hygiene, keep your hands away from your nose, mouth, ears, and eyes. And I want to conclude by thanking our healthcare workers, our first responders, our firefighters, and our law enforcement community for being on the front lines during these times and helping out. And I want a quick reminder to everybody that our staff remains committed and open for questions. And if you have any questions, please call 218-481-6396 or 202-225-6211. We know as a nation, when we come together, we can solve anything. And I have full confidence in the American people, our local states and communities, and our leadership that we too will get through this together, and we will have our after-action reports when it's over with. We'll do what we do. We'll know what we did good. We will know what we can do better. But for the time being, let's work together as a nation. We all live in the greatest country on earth that we get to call home. Thank you.
Good morning, I'm Sean Creuget, Fire Chief and City of Duluth Emergency Manager. I want to just reiterate that as we've been doing all week and for the last few weeks, we're working very diligently with our community partners, whether that's St. Louis County, the Minnesota Department of Health, State Homeland Security, and others across the region and the state. I want to remind people that as much as we hear about this as a public health issue, which it of course is, it's really a community emergency that affects schools, the business communities, vulnerable populations, not just here in Duluth, but region-wide, our first responders that are protecting the community. Please think about things as you're calling for help. Do you really need us? Is it really an emergency? Are you just uncomfortable, or do you need a response from law enforcement, from fire, from an ambulance crew? Please follow the recommendations that you're getting from the hospitals or from your doctor or the clinics. Sometimes the best thing you can do is just wait at home, kind of let it run its course, see how things are going. When you call 911 and you just because maybe you just don't like the answer you got the last time, that's really starting to drain all of our resources throughout the region. It's not that we won't come, but we really need the community to think about that and just consider the people who really are in need and do need an emergency response. We continue to follow CDC recommendations, the recommendations of the Department of Health and our local medical control on how we respond to these emergencies as first responders, as firefighters going in to medicals. We're continuing to follow the PPE guidelines that we've talked about all week. Nothing has changed there. So again, you may see firefighters in a mask, in goggles, in a gown, of course with gloves. Again, don't be concerned, but we do have to take those precautions for both our safety and for yours. We continue to work with St. Louis County Dispatch on the questions that they're asking you. We're trying to get the best information possible. Please be honest. If you do call 911, let them know what's going on. Let them know what your symptoms are. Don't over-exaggerate your symptoms, but also tell them what they ask, what they need to know. It's vital for us as we're coming in to prioritize calls. We're starting to get into some levels, not so much here in Duluth, but in some other areas where they're starting to tier calls as what we would call a code 3 or a tier 1 call versus a code 2 or a tier 2 call. And we really want to get the right resources there as quickly as we can. We continue to track the needs of our people experiencing homelessness in other vulnerable communities. Our Human Rights Officer, Carl Crawford, is working with all sorts of partners to make sure that those needs are heard and those needs are brought up to the proper, whether that's city leadership, county leadership, Department of Health. We've got a lot of people who really don't have anywhere else to turn, and we are working hard to meet those needs and make sure that people in that community and in those sometimes special groups know that we do have their backs and we are advocating for them as well. We're working with Lee Stewart and our partners like CHUM and the county to look at what we can do and how we need to expand resources for everyone in our community.
Hello, my name is Elena Fauché. I'm the Director of Workforce Development for the City of Duluth. We understand that this is a really difficult time for workers and employers. The City of Duluth's Workforce Development Department is acting fast to adjust our services to current needs following state and federal guidance. To maintain the health and safety of clients and staff, Duluth Workforce Development staff are working from home and eliminating in-person appointments. However, we're monitoring email and phone messages daily and reaching out to our clients. Staff from other agencies housed within Career Force have also moved away from in-person appointments, and many will be working from home. However, Career Force remains open at this time with some changes to our services. So in-person workshops are canceled. We're exploring a virtual option to help people with job search assistance and resumes and interviews. We'll announce that as soon as it's ready. Our Career Lab computers are available for unemployment insurance applications, job search, job applications, resume writing, and other employment-related uses. Use of the Career Lab will be limited to 5 people at a time, and we've made some other changes to the layout just to help support physical distancing and make sure that we can protect the health and safety of visitors and still provide assistance. Our phone lines are open. We've added extra staff to answer phones, and we'll answer as soon as possible. So if you have questions, you can call your Career Force Employment Counselor, or you can call our front desk at 218-302-8400. Workers who've been laid off or experienced a significant change to their employment due to the coronavirus are encouraged to apply online for unemployment. There's expanded eligibility, and we've changed, or the state has changed, some of the rules to try to get people access to benefits as quickly as possible. The website to apply for unemployment is www.uimn.org. Employers have a lot of questions right now about what happens for them, what supports are available for them. That's changing every day. Employers can find more information on DEED's website, and Duluth Workforce Development has also put together a resource guide for employers that we're updating daily. It's posted on the city website. There's many supports out there for both employers and workers right now. There's more coming. We'll keep our page on the Workforce Development page on the City of Duluth website up to date, and we'll also post updates on the Duluth Workforce Development Facebook page, so you can follow us there. Thank you.
Good morning. My name is Chris Fleege. I'm the Director of Planning and Economic Development for the City of Duluth. And part of my responsibilities include building inspection, construction services. As Mayor Larson and Director Fauché mentioned, we continue to hear how the COVID-19 is affecting businesses and individuals in the Northland. I wanted to give an update on my department and what my department is doing to ensure that businesses continue to have the services that they need as they're preparing to start projects, construction projects, and as they're trying to get their necessary permits. Our department is open. We're basically processing all those online. We used to process about half of our applications through a web-based interface. We're encouraging businesses to leverage that tool. We've got folks working remotely, and they're taking calls and responding back to applicants with questions. We're setting up web conferences with folks as we're going through. So the message is really that if you've got a project, a renovation, a rehabilitation that you're doing, that our team is available and here to serve you. So we want people to continue to know that even though the city offices may be closed, you have access to our team, and our team is very engaged. Like all departments at the city, our team is working to continue serving businesses and individuals during this difficult time. We may not be in the office physically, but our folks are diligently working to respond and support construction projects within our community. So we wanted to assure you of that and let you know that we're here to serve. Thanks.
Hello, and thanks for being here today. Kevin Gray, St. Louis County Administrator. And first I want to thank Mayor Larson and her team for continuing to host these conferences that helps to get the messages out to our residents and even to our employees who are now many working from home. This is an important service, so thank you, Mayor Larson, for that. I've got a few updates from a county perspective, and I'll try to go through them very quickly and turn the floor over to Amy Westbrook, our Public Health Division Director, who has the broader messaging around our public health responses. County buildings are closed today and tomorrow. This is going to afford us a chance to do longer-term planning and see what the new norm, to borrow Mayor Larson's phrase, will be for county in terms of services and walk-up services, if any. We expect to announce an updated schedule tomorrow afternoon. A couple of notable exceptions to county building closings. Courthouses remain open to support court operations. There's been some confusion around that, and I want to reiterate that the courthouses in in Hibbing, Virginia, and here in Duluth remain open to support court operations. Also for Northern St. Louis County residents, just a heads up that our county landfill and transfer stations and solid waste drop-off sites remain open. We need to continue those services. As has been reported on Tuesday, the county board held an emergency meeting and unanimously approved declaring a state of local emergency. Like the city and like other cities and counties throughout the state, this affords more flexibility to administrative staff in support of the commissioners and our elected officials, so we can react as quickly as possible to the rapidly changing situation that is the coronavirus. The challenge is particularly unique and tricky for those of us at the county in terms of what services and how we provide services to the public. Most of our, if not all of our services, are mandated by the state and local federal governments. So that puts us in a position of complying with statutory direction and trying to balance, of course, how we deliver those services in a safe manner, both for our residents and our employees. So we can't just close down unilaterally. We're going to continue to provide services that arguably are more in need for many of our vulnerable residents and those in legal and other scenarios that are needed now more than ever. So we are working hard to promote a continuity of services model, but of course prioritizing the health and safety of our employees and the public. Just to give a heads up on steps that we're taking from an employee standpoint, we recognize that different departments have different needs and capabilities. So we're giving department heads and going through aggressive planning efforts, giving department heads broad latitude to implement maximization of flexible scheduling, weekends, evenings, to promote social distancing, to promote the ability of our employees to provide family care and well care. We are greatly enhancing and being much more flexible with the use of mobile working. We anticipate over the next several days to have quite a number of our people being able to work from home while still providing needed services and supporting the operations of the county. We are encouraging people who have underlying symptoms or issues at home to make use of the paid time off that's available to them, and being very flexible and understanding that we need to support people's decisions on that front. So we'll continue on the mobile working front in particular to try and maximize people working from home and distancing, if you will, but also recognize that we need to have on-site presence as well. So just as a reminder in that vein, we also are encouraging the public to please be aware that we're providing services by phone, email, online. We're working hard to update our website. We're adding things today with links to various public health and clinic links that we think will benefit people that are looking for answers around the virus. But with respect to county operations, we are very aggressively working to make the website be a portal point in addition to email and phone calls. Finally, I would just conclude with we recognize these are challenging times, uncharted waters, definitely. We're very committed as a team, very supported by our commissioners. We're going to be working hard to be flexible and continue to update the public and our employees as we make decisions and strategic plans around the best way to deliver services and protect the health and well-being of our citizens and our workers. thank you for your time and the vital role the media does in messaging for so many people. Appreciate it.
Good morning. I'm Amy Westbrook with St. Louis County Public Health and Human Services, the Public Health Division Director. I want to thank Mayor Larson again for having these press briefings. I think it's really important to get as much messaging out as we can. Things are changing daily, and as the fire chief mentioned, this is challenging times for all of us. All aspects of our community are really being affected. This is representative of how broadly we have so many aspects of our community viabilities represented here. So these are really challenging times and scary times for some people. So please know that we have a lot of community partners coming together in planning and response for this. It's a big community effort to assure that we're doing what's right in public health, but right also in maintaining our communities and keeping them going. So we're always reevaluating our public health recommendations. We base them on science and current resources. So they do change, but we recognize that it's a very rapidly changing situation. So please keep updated through the Minnesota Department of Health, the CDC, the Centers for Disease Control and Prevention. We have those links to their information listed on our website, as the city does. Right now, we know that across the state for our MDH diagnostic lab, or the public health lab, testing is limited. So we have limited testing recommendations to healthcare workers, individuals who are living in group congregate care settings, and hospitalized individuals. So we ask that if you are experiencing respiratory symptoms that you can manage at home, that you please stay home. Stay home for 7 days or 72 hours after your fever resolves. And self-isolate. Individuals who are contacts of those people who are experiencing respiratory symptoms, please practice good social distancing, limit your outside time or interactions with people for 14 days. So these are changing recommendations in terms of impacted by the capacity that we have for testing. But for everybody, we are certainly recommending continuing to wash your hands, practicing good social distancing, keeping resources on hand if you do need to stay home and isolate yourselves, using alcohol-based hand sanitizer. And we're doing all of these activities as a community to make sure that we're protecting our most vulnerable individuals, our individuals who are most at risk for complications, older individuals, and people with immunocompromised immune systems, and to protect us all. We do see severe illness in healthy individuals too. Most of us will be able to fight off this coronavirus, but many of us will also, especially those who are most vulnerable, could have more severe illness. Let's see, as a community, we're recommending that events of any size should be continued only if social distancing can be implemented and proper hand hygiene can be supported. We are, as a public health system, offering guidance and decision making when organizations, groups, county, government entities, schools are going through these decision making processes of what sort of services are still offered. How do we, what sort of best decisions should we make with public health recommendations? We're available to consult on these decisions, and we're also available for providing good public health education based in science. We continue to ask people to change their behavior and do all of these good healthy behaviors that will help protect individuals as well as all of us in our community, and to maintain those behaviors. So we keep saying, Governor Walz said yesterday, it's not a blizzard but a winter, and so it is going to take some maintained behavior change for all of us to make sure that we're protecting each other, our communities, our neighbors. As of yesterday, we have 77 confirmed cases in Minnesota, still none in St. Louis County, which is a good thing. But with limited testing, we want to be vigilant about our respiratory illnesses. So please follow those guidelines about staying home, social distancing if you're having if you're experiencing respiratory illnesses. And I have been really, really proud of how we've come together as communities in Duluth and across St. Louis County to work together to do what we can in implementing good public health practice. So thank you.
Good morning, I'm Bill Gronseth, Superintendent of Duluth Public Schools. I have to begin this morning with a shout out to the ISD 709 staff who have been hard at work making sure that our families...
We just heard from some city leaders about their updates. We're going to continue to update you about all of that on our website, WDIO.com, and of course on air tonight. We're going to go live now to President Trump and his administration. They're also providing an update on their efforts. We're going to join that ABC News special report in progress.
You probably shouldn't have anybody sitting behind you either. You should probably go back, but I love it. It's so much nicer, but I shouldn't say that because you'll get me now. Thank you all for being here, and we continue our relentless effort to defeat the Chinese virus. Before I begin, I want to start by announcing that today we are bringing home another American citizen. It was a big thing, very big. Omar Fakouri is on his way back to the United States after being imprisoned in Lebanon since September of 2019. He's battling late-stage cancer. Mr. Fakouri will now be able to receive the much-needed care and treatment in the United States. We've been working very hard to get him freed, and he's finally able to have his entire family at his side. So I'm very grateful to the Lebanese government. They worked with us, and we are very proud of his family. They stood by him so strongly, and they are thrilled. The United States has no higher priority than the safety and well-being of our citizens. We've gotten a tremendous number of hostages out, as you know. I think we're 42-0, and Robert O'Brien, as you know, was our chief negotiator for a large part of it. In fact, did so well that now we have him in a different position. So I want to thank and congratulate Robert and his team, and I want to let everyone know that recovering Americans held captive and imprisoned abroad continues to be a top priority for my administration. We have one young gentleman, Austin Tice, and we're working very hard with Syria to get him out. We hope the Syrian government will do that. We are counting on them to do that. We've written a letter just recently, but he's been there for a long time, and was captured long ago. Austin Tice, his mother's probably watching, and she's a great lady, and we're doing the best we can. So Syria, please work with us, and we would appreciate you letting him out. If you think about what we've done, we've gotten rid of the ISIS caliphate in Syria. We've done a lot for Syria. We have to see if they're going to do this. So it would be very much appreciated if they would let Austin Tice out immediately. As you know, my administration is working every day to protect American people and the American economy from the virus. Yesterday, I signed into law a critical support for American workers, families, and small businesses. It's a big thing. We're providing sick leave and family medical leave to those affected by the virus, and more help is on the way as we speak. Our entire team, headed by Secretary Mnuchin, is on the Hill. We're working with Democrats and Republicans, and there's a lot of goodwill going on. This was something that happened that was, some people would say, an act of God. I don't view it as an act of God. I would view it as something that just surprised the whole world. And if people would have known about it, it could have been stopped in place. It could have been stopped right where it came from, China. If we would have known about it, if they would have known about it. But now the whole world almost is inflicted with this horrible virus, and it's too bad. It's too bad, because we never had an economy as good as the economy we had just a few weeks ago. But we'll be back, and I actually think we'll be back stronger than ever before, because we learned a lot during this period of time. I also just invoked the Defense Production Act to help facilitate distribution of essential supplies if necessary. We're working with Congress to provide major additional relief to the workers, small businesses, and the hardest hit industries. We want to make sure that everybody is able to continue on so that when we recover, all of these companies and these great businesses, both very, very small and very, very large, are not going to be broken up, and you'd have to put them back together. That would take a long time, because we really believe in, I believe in the V curve. I believe it's going to go, when this is defeated, this hidden scourge is defeated, I think we're going to go up very rapidly, our economy, and get back to where it was and beyond. Today I want to share with you exciting progress that the FDA is making with the private sector as we slash red tape like nobody has ever done it before. Somebody was on yesterday on one of the networks and said that there's never been a president even close that's been able to do what I've done in slashing all of the red tape and everything to get very important things to the market, medical. So we slash red tape to develop vaccines and therapies as fast as it can possibly be done, long before anybody else was even thinking about doing this. And as you know, earlier this week, we began the first clinical trial of a vaccine candidate for the virus, and that was launched in record time. It was just a few weeks, and that would have taken years to do, not so long ago. As we race to develop a vaccine, we're also pursuing antiviral therapies, and that's what really we're going to be talking to you about today. That's the purpose of being up here today. And to me, that's even more important. The vaccine, by its nature, you have to have long tests, because you have to make sure what goes into somebody's body is not going to do destruction, do bad things. So you need long tests. And they're doing great with the vaccines, but it's still a long process. But the therapies are something we can move on much faster, potentially. And the treatments that will be able to reduce the severity or duration of the symptoms, make people better. Essentially, we're looking at things to make people better, or at the very earliest stages, they wouldn't even know they had it. And that's where I believe it's going to work even the best. The FDA Commissioner, Stephen Hahn, who's with us, he's fantastic. And he has been working 24 hours a day. He's been, he's worked like probably as hard or harder than anybody in the group, other than maybe Mike Pence or me. And what the FDA is doing is incredible. They've done things in times that were not even thinkable. And I've directed the FDA to eliminate outdated rules and bureaucracy so this work can proceed rapidly, quickly, and I mean fast. And we have to remove every barrier. There were a lot of barriers that were unnecessary. And they've done that to get the rapid deployment of safe, effective treatments. And we think we have some good answers. We'll find out very, very soon. Clinical trials are already underway for many new therapies, and we're working on scaling these to allow many more Americans to access different drugs that have shown really good promise. We've had some really good promise. We will do so in a way that lets us continue to collect good data to know which medicines are safe and which medicines are working the best. We have a couple that we're in really good shape on, and that's for immediate delivery. Immediate, like as fast as we can get it. The FDA has also approved compassionate use for a significant number of patients. You know what that means. We're also reviewing drugs that are approved abroad or drugs approved here for other uses. And you know, one of the things that I'm most proud of that I got was right to try. That's where somebody who's ill, somebody who's very sick, terminally ill usually, in past administrations, we signed this a year and a half ago. You wouldn't be able to even think about getting any of the drugs that may be showing great promise now. And they've been trying for many decades to get this approved. And it sounds simple, but it's not, because there's liability involved and lots of other things. And I was able to get it approved working with Congress, right to try. This is beyond right to try. What we're talking about today is beyond right to try. Right to try has been, by the way, a tremendous success. People are living now that had no chance of living, where we take treatments that would, things that would have to go through years of a process. And if somebody was terminally ill, and I would say, why wouldn't they be able to try this? They'd go to Asia, they'd go to Europe, they'd go all over the world to try and find something. Or some people, if they had no money, would go home to die. They'd go home to die. They had no hope. Right to try has been an incredible success. But this is beyond right to try. If treatments known to be safe in Europe, Japan, or other nations are effective against the virus, we'll use that information to protect the health and safety of American people. Nothing will stand in our way as we pursue any avenue to find what best works against this horrible virus. Now, a drug called chloroquine, and some people would add to it hydroxychloroquine. So chloroquine or hydroxychloroquine. Now, this is a common malaria drug. It's also a drug used for strong arthritis. Somebody has pretty serious arthritis. Also uses this in a somewhat different form. But it is known as a malaria drug, and it's been around for a long time, and it's very powerful. But the nice part is it's been around for a long time. So we know that if things don't go as planned, it's not going to kill anybody. When you go with a brand new drug, you don't know that that's going to happen. You have to see, and you have to go long test. But this has been used in different forms, very powerful drug in different forms. And it's shown very encouraging, very, very encouraging early results. And we're going to be able to make that drug available almost immediately. And that's where the FDA has been so great. They've gone through the approval process. It's been approved. And they did it. They took it down from many, many months to immediate. So we're going to be able to make that drug available by prescription or states. I spoke with Governor Cuomo about it at great length last night. And he wants to be right on the, he wants to be first on line. And so I think that's there's tremendous promise based on the results and other tests. There's tremendous promise. And normally the FDA would take a long time to approve something like that, and it was approved very, very quickly, and it's now approved. By prescription, individual states will handle it. They can handle it. Doctors will handle it. And I think it's going to be great. Then we're quickly studying this drug, and while we're continuing to study it, but the studying is going to be also done as it's given out to large groups of people, perhaps in New York and other places. We'll study it there. There are promising therapies produced by Gilead, and that's remdesivir, and that's a drug used for other purposes that's been out and it's had very good results for other purposes, but it seems to have a very good result having to do with this virus. And that drug also has been approved, or very close to approved in that case, by the FDA. And I can't tell you how much we appreciate what the FDA, these people are incredible patriots, and the job that Stephen Hahn is doing, Dr. Hahn, who's one of the most respected doctors in the country, by the way, where we took him. I said, "You sure you want to do this?" Now, we didn't know that this was going to be in the playlist, what happened here, but he really has stepped up to the plate. Wherever you are, where is he? You really have. I'd shake his hand, but I'm not supposed to do that. Get in a lot of trouble if I did that. But he's been fantastic, and I thank you, Doctor. He's going to speak right after I'm finished. So, Regeneron again, is a company that's done fantastically well, as I understand, with Ebola and some other things. Great company, and they're looking at some very promising events also. So you have remdesivir, and you have chloroquine and hydroxychloroquine. So those are two that are out now, essentially approved for prescribed use. And I think it's going to be very exciting. I think it could be a game changer, and maybe not. But I think it could be, based on what I see, it could be a game changer. Very powerful. They're very powerful. So I want every American to know that we're doing everything we can, and these actions are important next steps. I mean, for the FDA to act the way they acted with this kind of speed is an incredible thing. Normally they'd say, well, we can have it by next year, or we can have it in 2 years from now. You understand? This is the way. Normally it's like years and years and years. They had it immediately, based on the fact that it's been used for other things, totally unrelated things. We believe these therapeutics and others under evaluation right now will be able to provide relief to many Americans. We really hope that's going to be. This could be a tremendous breakthrough, And we will work toward a much-needed vaccine in the future, as I said. And what we're doing with the FDA is so exciting in so many other fields. So many things are happening. It's a very exciting time for medicine. And we appreciate that the American public has pulled together. They're really staying home. And I think there's tremendous spirit in this country right now. It's spirit like a lot of people have not seen. People have not seen anything like it for a long time. And that means Democrat, Republican, they're pulling together. I hope everything's going good on the Hill. Maybe I shouldn't say this until I check out what's going on, because you never know. But I think there's a great spirit where the Democrats, the Republicans, and everybody else are getting together and they're trying to get things done. But most importantly, the American public has been incredible. We took the best economy we've ever had, and we said, stop, you can't work. You have to stay home. You know, there's never been a case like this. Normally, you pay a lot of money to get things going. Here's a case where we're paying a lot of money to stop things because we don't want people to be together so that this virus doesn't continue onward. So there's never been anything like this in history. There's never been. Nobody's ever seen anything like this. But we're doing the right thing. We have to get rid of, our big war is it's not a financial war. It's a war, and it's a medical war. We have to win this war. It's very important. With that, I'd like to just introduce Dr. Stephen Hahn. And again, I'd like to send back with Stephen our thanks to all of the people working in the FDA who are fantastic, talented people. We appreciate it very much, everything you've done, especially the speed that you got these two elements, these two very important drugs passed. Thank you very much. Thank you, Stephen.
Thank you, Mr. President. I want to thank you for your leadership during this coronavirus outbreak, and thank you for the kind words about the FDA staff. We have 10,000 scientists, doctors, and others, and more than that, working around the clock to aid the American people in this fight against the coronavirus, and those words are very much appreciated, sir.
Thank you.
So before the President nominated me and I was confirmed as Commissioner of Food and Drugs, I was a cancer doctor. And I've sat across from countless number of patients and had to talk to them about their diagnosis and their treatment. And one thing that was really important is to provide hope. I have great hope for how we're going to come out of this situation. What's also important is not to provide false hope, but to provide hope. And as a doctor, that's the way I come to this. I'm speaking now to the American people as Commissioner of Food and Drugs, but that part of me has not left. Just look at the way the American people have responded to our calls for mitigation, for social distancing. The American people have great resiliency, and I am so incredibly proud of how the American people have responded. As the President mentioned, he asked us to be aggressive, to break down barriers to innovation, and to accelerate the development of life-saving treatments. And we're doing that at the FDA. The FDA is committed to continuing to provide regulatory flexibility and guidance. But let me make one thing clear. FDA's responsibility to the American people is to ensure that products are safe and effective. And yet we are continuing to do that. Our folks and their tremendous professionals are working day and night to do this. You just can't even imagine how much they're working to provide this support for the American people, and I thank them. Since early January, long before the first domestic case, FDA began working in collaboration with CDC. I also want to note that we stood up an incident command group and have been focused on the coronavirus since the very beginning of this public health emergency. This is, in addition, an all-of-government and all-America approach, and I'll describe what I mean by that in terms of the development of therapeutics. An important part of that work is expanding the potential therapeutic options associated with coronavirus, and we've learned from our colleagues across the globe about this. But I want to focus on one thing. I was a cancer researcher before all this, and one thing I know about this great country of ours is that we have unbelievable innovators. We have people who every day, it's their job to develop treatments for all sorts of diseases. We are incredibly blessed as a country to have this. And as is true in any illness, these great American innovators, academia, private sector, they have engaged us about the best possible treatment options. We are looking at everything that's coming across our desks as possible treatment options for coronavirus. And we're extremely encouraged by the interest and the promise that we've seen from these great American innovators. Now again, we need to look at it. We need the data. We need the information to make the absolute best decisions for the American people. But I want to assure you, we have over 17,000 people at FDA who are doing this every day. We need to make sure that the sea of new treatments will get the right drug to the right patient at the right dosage at the right time. As an example, we may have the right drug, but it may not be in the appropriate dosage form right now, and that may do more harm than good. Those are the things that's our job to look at, and that's why it's really important we have these dedicated professionals looking at these aspects of therapeutic development. At the same time, we're also working through different mechanisms to actually get drugs into the hands of providers and patients. The President mentioned this, but one of the mechanisms is called compassionate use. Let me just tell you about this. If there's an experimental drug that's potentially available, a doctor could ask for that drug to be used in a patient. We have criteria for that and very speedy approval for that. The important thing about compassionate use, and that's what the President meant, this is even beyond right to try, is that we get to collect the information about that. Because one of the things, and our promise to the American people, is we will collect the data and then make the absolute right decisions based upon those data about the safety and efficacy of the treatments. We are working expeditiously, and we are working to make sure that these products are as safe and effective as they possibly can be. Let me tell you about a few things that we're currently working on. And this is a plan that was developed with many of the people at this table, our infectious disease experts on the task force. In the short term, we're looking at drugs that are already approved for other indications. So they're already approved, as the President said, for other diseases. As an example, many Americans have read studies and heard media reports about this drug chloroquine, which is an anti-malarial drug. It's already approved, as the President said, for the treatment of malaria as well as an arthritis condition. That's a drug that the President has directed us to take a closer look at as to whether an expanded use approach to that could be done to actually see if that benefits patients. And again, we want to do that in the setting of a clinical trial, a large, pragmatic clinical trial, to actually gather that information and answer the question that needs to be answered and asked and answered. Let me give you another example. There's a cross-agency effort about something called convalescent plasma. This is a pretty exciting area. And again, this is something that we have given assistance to other countries with as this crisis has developed. So FDA has been working for some time on this. If you've been exposed to coronavirus and you're better, you don't have the virus in your blood, we could collect the blood. Now, this is a possible treatment. This is not a proven treatment. Just want to emphasize that. Collect the blood, concentrate that, and have the ability, once it's pathogen-free, that is virus-free, be able to give that to other patients, and the immunoglobulins, the immune response, could potentially provide a benefit to patients. It's another thing that we're looking at. Over the next couple weeks, we'll have more information that we're really pushing hard to try to accelerate that. That's in the sort of more medium short term, and that'll be a bridge to other therapies that will take us 3 to 6 months to develop. And this is a continuous process. There is no beginning and end to each of this. This is, we're pushing this through. The other great thing about the great innovators of America, some of them tell us it's taken us years to develop therapies. They're looking at pushing that to the months period of time. And we're trying to provide them the regulatory flexibility, but at the same time the scientific oversight to make sure that gets done in the best way possible for the American people. The President mentioned that there is a vaccine trial currently being performed. It's a phase 1 trial, so it's the earliest study that gets done. We expect that to take 12 months to get to completion, to actually a time where we could approve a vaccine. But these are all things to bridge to the prevention part of this with a vaccine. It's exciting work, and the President is right. This is record time for the development of a vaccine, and impressive public-private partnership. The FDA's efforts to facilitate the development of these products are focused on ensuring timely access while also meeting the agency's world-respected gold standard, relying on strong data from clinical trials to determine if an experimental or an off-the-shelf drug that's used for something else can safely and effectively treat patients. We want to assure the American people that FDA is all hands on deck, as the President mentioned, these efforts, and continue to work with interested sponsors to help expedite the work. We remain steadfast in helping to foster the development of safe and effective therapies for COVID-19. Thank you.
Thank you very much. Mike? Talk about the masks.
Thank you, Mr. President. The White House Coronavirus Task Force met this morning, and on this very first day of spring, we continue to make steady progress toward President Trump's objective not only to marshal all the resources of the federal government, every state government, every local health official, but also to harness the power of the American private sector, and activities over the last day reflect all of those priorities. Yesterday, the President spoke with America's top physicians and nurses and garnered helpful insights about how we can best serve those who are serving Americans that are dealing with the coronavirus. We also had a productive call with over 5,000 state and local officials explaining the federal government's approach and our strong and seamless partnership with all 50 states and the territories. Last night, as you heard, the President signed the Family First Coronavirus Response Act, which provides free coronavirus testing, paid sick leave, family leave for caregivers, and food assistance for the needy, among a broad range of benefits. And today, as the President indicated, we expect that the Senate will begin work on an economic relief package. Later today, the President and I will meet again in a teleconference with the nation's governors. We will meet at the National Response Coordination Center at FEMA and outline President Trump's decision to have FEMA take the lead in our national coronavirus response. Our nation's response through FEMA will be locally executed, state managed, and federally supported. On testing, we want the American people to know once again that testing is available in all 50 states and is becoming increasingly available literally every hour of the day. Because of the public-private partnership that the President initiated several weeks ago with major commercial labs, I'm pleased to receive a report today that tens of thousands of tests are being performed every day. And with the passage of last night's legislations, state and private labs are now required by law to report all coronavirus testing directly to the CDC, which will give the American public and also give our researchers timely and important information. It's important for every American to remember that if you don't have symptoms, you don't need to get a test. We want to make sure that testing is available for people that are experiencing symptoms or have a genuine concern about having been exposed to someone with the coronavirus. Dr. Birx will address county-level data as well as the progress we've made on testing, and Americans can expect to see how an increased number of cases as our new testing system comes online should not be a cause of concern. She'll explain the importance of taking into account our new testing system as new data arrives over the next several days. On supplies, a priority the President has given to our task force, we continue to work with healthcare providers, businesses, and state leadership to identify available supplies, not merely in the federal stockpile, but much more importantly, available across the private sector. We're encouraged to see companies like Honeywell and 3M that I visited a few short weeks ago take advantage of the changes in the law last night that allow the sale of industrial masks directly to hospitals. Those companies have now greatly increased by the tens of millions their production of so-called N95 masks that will give our healthcare workers the protection that they need to minister to those that are dealing with the symptoms or the disease of coronavirus. Following the signing of last night's bill, all of those masks now have liability protection, and the companies can sell industrial masks to hospitals. It is encouraging, as we called out yesterday, to see construction companies all across America that are, as we speak, checking their supplies and donating those industrial masks to their local hospitals. And I know I speak on behalf of the President, who spent a lot of time as a builder, when we thank builders across America for partnering with our local healthcare officials. On the subject of ventilators, we're working with healthcare providers around America and suppliers. And we're encouraged to learn that we've literally identified tens of thousands of ventilators that can be converted to treat patients. And we remain increasingly confident that we will have the ventilators that we need as the coronavirus makes its way across America. But as we said before, we're all in this together. And before I step away and give the podium back to the President and to Dr. Birx, I want to call every American's attention again to the President's 15 days to slow the spread. We continue to hear one case after another, one city after another, where people are putting into practice the principles that the President outlined this Monday. And make no mistake about it, that while for the American people as a whole the risk of serious illness remains low, these guidelines should be practiced by every American in every community, not only to lessen the spread of the coronavirus, but to protect the most vulnerable among us. And I think Americans from their hearts are not only practicing these principles of social distancing and avoiding social gatherings of more than 10 people, using drive-thrus at restaurants to protect their own health and the health of their family, but they're also recognizing that no American wants to inadvertently convey the coronavirus to someone for whom the consequences could be quite serious. At the President's direction, we'll continue to marshal all the resources of government at every level. We'll be reiterating that strong partnership with America's states this afternoon, with America's governors, pulling all of the private sector energy together, the innovation that you just heard described. I know on this first day of spring that we'll get through this, and we'll get through this together. Thank you, Mr. President.
Thank you very much. Dr. Chris.
Thank you. Thank you, Mr. President. So I know you're watching the data carefully. You can see the dramatic increases in the number of new cases based on our ability to test additional people. And this will continue over the next 2 to 3 days as we begin to have backlogs reduced of the testing. You all have heard the anecdotes of people waiting 5 or 6 days for their test results. We are moving through all of that as well as testing individuals. I really want to applaud the frontline healthcare workers, the nurses and the doctors and the testers that have really prioritized, and the American people who have prioritized those with symptoms. The number of test positives is increasing. That is a dramatically important signature that everybody is doing their job. Those with mild symptoms are staying home, self-isolating. Those with serious symptoms are coming forward to getting testing. Our test positive rates are now into the 10 to 11% range. That still means that 90% of the illnesses out there, even the severe ones, are not COVID-19. I know many of you are looking at the state level data. Still, over 50% of the cases come from 3 states. This is why we continue to prioritize testing in those states. In addition, 50% of the cases come from 10 counties. We're a very large country with very many counties, and I just want to applaud the local and state governments that are implementing their emergency operations centers and plans to ensure. I want to also really thank the healthcare workers that have been asked to reduce all elective surgeries, medical, and dental visits. This will dramatically increase the number of ventilators that are available in hospitals, but also in ambulatory surgical centers that can be converted and utilized. And also to the construction industry. We are deeply grateful the number, as Vice President said, the number of individuals have come forward with their construction masks, their booties, their Tyvek suits, and their masks to contribute them to the healthcare sector. The President's request to make this available in that legislation changes the ability and increases our availability immediately by in the 75 to 90% range because of the amount of construction use of those elements. Thank you.
Thank you, Doctor, very much. Jerome, please.
Thank you. Thank you, Mr. President, Mr. Vice President. Today, you heard a wonderful announcement from the FDA, and I just want to give a shout out to Steve, Dr. Hahn, and the folks at the FDA where several hundred of my Commission Corps officers work. You're right, Mr. President. They are tireless. They're doing things that have never been done before to bring the most prudent advances to the American people. But I want to talk about something different briefly. We know many of you are home practicing the President's guidelines for social distancing. But one thing we should all consider, especially our millennials and Gen Z, is donating blood. As an anesthesiologist who still practices at Walter Reed taking care of our wounded warriors and our soldiers, I know donated blood is an essential part of caring for patients, and one donation can save up to 3 lives. Blood centers are open now and in need of your donation. I want America to know that blood donation is safe, and blood centers are taking extra precautions at this time based on new CDC recommendations, including spacing beds 6 feet apart, disinfecting surfaces between patients, temperature checking staff, and encouraging donors to make appointments ahead of time so we can space them out. Social distancing does not have to mean social disengagement. So give blood today. You'll feel good about it, and you'll be helping your country and your community during this crisis. And you might even save a life.
Thank you, Jerome.
Thank you.
Mr. President?
Yeah, please. Go ahead, Jim.
Mr. President, switching to the efforts to boost the economy with the measures before Congress, will you guarantee that the money, the billions, the tens of billions of dollars, hundreds of billions of dollars even, that's going to go to these industries will not go to executive bonuses or to more stock buybacks?
Well, we don't want that. In fact, some companies, as you know, did stock buybacks, and I was never happy with that. It's very hard to tell them not to, but I would tell them not to. I would say I don't like it for that reason. Some did, and it turned out that they could have waited a long time. It would have been much better off if they did.
You can make it a condition of the bill. You can say that none of this money can go for that.
I wouldn't mind making, I mean, you know, it takes many, many people in this case to tango. But as far as I'm concerned, that conditions like that would be okay with me. John?
Mr. President, if I could, a question for you and then a question for Dr. Hahn. You enabled, I guess is probably the best way to put it, the Defense Production Act yesterday, but you didn't pull the trigger on it.
No, because we hope we're not going to need that.
You're getting a lot of calls on Capitol Hill from the Democratic leadership to pull the trigger on it. What's the rationale for not doing it?
First of all, governors are supposed to be doing a lot of this work, and they are doing a lot of this work. The federal government's not supposed to be out there buying vast amounts of items and then shipping. You know, we're not a shipping clerk. The governors are supposed to be, as with testing, the governors are supposed to be doing it. We'll help out, and we'll help out wherever we can, and we can buy in volume, and in some cases, great volume. With the masks, as an example, which were really a problem. We have helped out, and there are right now millions of masks being made. But this is really for the local governments, governors, and people within the state, depending on the way they divide it up. And they'll do that, and they're doing a very good job of it. Where you have a problem with ventilators, we're working very hard trying to find. Nobody in their wildest dreams would have ever thought that we need tens of thousands of ventilators. This is something that's very unique to this, to what happened.
Under what conditions would you put the Defense Production Act into action?
Well, if we were desperately in need of something, and we frankly will know about that very shortly. We want to be ahead of, we don't want to do it as it happens, but before it happens. We're going to know a lot over the next 2 or 3 days. We'll know a lot.
For Dr. President. Dr. Hahn, any idea when remdesivir will be available to the market? And are there any drugs in the pipeline that you believe could qualify for a treatment IND?
So with respect to the first question, I'm prohibited by law to disclose confidential commercial information. What I can tell you is we're working very closely with the company on this, and we'll have additional information. They will relatively soon. Yes, there are drugs in the pipeline. We're looking at everyone. Everyone on this dais gets calls every day, as do all of our people at the FDA, about potential therapeutic options. We are looking at every single one of them.
Mr. President, 2 questions for you. One on coronavirus, but just really quickly, are you confirming that Austin Tice is still alive?
No, I'm not, but we're trying to find that out. This has been going on for years. Many years they've been trying to find Austin Tice. He was in Syria, as you know. His mother is an incredible woman. And I'm doing it for him, but I'm doing it for his mother. His mother's an incredible woman who's desperate to find her son. And I'm not confirming alive, but if he is alive, we would like very much to get him back quickly.
Okay, and on coronavirus, speaking of shortages of supplies, the CDC has put out guidelines for hospitals that are dealing with a shortage of masks to use them beyond their shelf life, reuse them instead of getting new ones, and in a worst case scenario, use a bandana instead of a mask. How is that acceptable at all?
Well, I haven't seen that, but I will let Mike answer that question, Vice President.
I'm happy to, Mr. President. I can't emphasize enough the incredible progress that was made with the passage of the legislation last night. The President had me go to Minnesota and meet with 3M that manufactures these N95 masks a few weeks ago. And we learned of their production at that facility of 35 million masks a month. Less than 5 million of those were qualified to be sold to hospitals. So the President worked with Republican and Democrat leadership. We've extended the liability protection. So now that all the industrial masks that are manufactured as N95s are now available to hospitals, and we're seeing a dramatic increase in production. Honeywell alone is repurposing a factory that was destined for Mexico to produce another 120 million masks per year. 3M is increasing output to 420 million masks per year. We've put a priority at the President's direction on making sure those that are providing health care services to America have the protection to keep themselves and their families safe. And with the legislation last night, with the incredible response among these great private sector companies, and as we mentioned repeatedly, with construction companies around America heeding the President's call to donate their industrial masks to hospitals, it's happening all over America. We know we'll meet that need.
But when will those be ready? Isn't that kind of sad they have to use a
being made, and when will they be ready, or at least we start getting them ready?
Well, as I mentioned, 3M is increasing their output to 420 million a year. At production in January, they make 35 million per month at that facility, and we're prioritizing the distribution of those. But the other thing, and we'll emphasize this with governors this afternoon, is we're working with governors to make sure that the healthcare providers, the hospitals, and the clinics in their state are placing orders now that this tremendous increase in supply, particularly with industrial mass, is now available. We're going to make sure they understand that the supply has greatly expanded thanks to bipartisan legislation and the accomplishment of the president. And the response by these companies is making more masks available. And we're going to make sure healthcare providers are purchasing those. And the federal government will also make sure that our stockpile is properly reflects those increases as well.
So, on the president's question, when will those masks be ready